You probably have a diagnosis right now that no doctor has ever given you. You picked it up somewhere between 1 a.m. and sunrise, watching strangers on your phone list the 11 things only people with ADHD do. You had 8 of them. Then a video told you that if you have ever zoned out in a long conversation, you might have autism. Then another said your need to organize your closet by color is not a personality trait, it is OCD. And by the time you put the phone down, something had shifted. You were not the same person who picked it up. You were now, somewhere quietly inside yourself, a person with a label no doctor ever gave you, a label that came from an algorithm. This is happening to millions of adults right now, and the science behind it is far stranger and far more disturbing than the videos let on. In the next 8 minutes, I am going to show you the one specific signal that separates a healthy curiosity about your own mind from a belief that may actually be harming you. You will know how to tell the difference, even at 2 a.m., even when the algorithm is doing everything it can to convince you otherwise. Stay with me, because this is the part of the conversation that the people making those videos do not want you to hear. Let us start with what is actually happening on your screen. This is not a new problem. It is a deepening one. In 2022, researchers at the University of British Columbia examined the top 100 ADHD videos on TikTok and found that 52% of them were misleading. That was the warning shot. 3 years later, the same university ran the experiment again. The 2025 study, published in PLOS One, found the problem had not improved. Fewer than half of the claims in the top 100 videos aligned with clinical standards for ADHD. But the most haunting finding was not about the videos. It was about the viewers. In a pre-registered experiment, researchers presented these videos to a cohort of over 800 young adults, and they found something that should stop you cold. Heavy viewers of this content were overestimating the actual prevalence of ADHD in the population by as much as 10 times. 10 times. An entire generation has quietly been miseducated about how common this condition really is, about whether the symptoms they see in themselves are statistically remarkable or simply human. And why are we listening to TikTok in the first place? Because the system is failing us. In parts of the United Kingdom, NHS waitlists for an ADHD assessment have stretched to between 5 and 8 years. In the United States, the picture is more uneven. Some patients can get an evaluation within weeks for as little as $200, while others wait months and pay over $1,000. When the system answers in years or in a bill you cannot afford, of course you turn to the algorithm that answers in 30 seconds. The wonder is not that this is happening. The wonder is that we expected anything else. And here is where the research gets even stranger. The same study found that when participants who had already self-diagnosed with ADHD were shown the videos that clinical psychologists rated as the most misleading, their belief in their own diagnosis did not weaken. It strengthened. The lower the quality of the video, the more confident they became. The expert correction bounced off them like rain off a windshield. That should stop you cold, because it tells us something the algorithm cannot say out loud. Once a belief about your own mind takes root through these videos, evidence to the contrary stops mattering. The label has already done its work. This is what psychologists are now calling concept creep. It is the slow, almost invisible widening of a clinical category until it includes traits that are simply part of being human, forgetting where you put your keys, getting bored in a long meeting, finding it hard to start a task you do not want to do, feeling overwhelmed in a noisy room. These are not symptoms. These are descriptions of being alive in the 21st century. But when you watch 50 videos in a row telling you they are symptoms, your brain begins to do something remarkable. It begins to rewrite your memory of yourself. You start to recall instances of the trait you did not previously notice. You start to interpret old behaviors through a new lens. And slowly, without realizing it, you build a case for a diagnosis the algorithm has been quietly building for you. So why is this happening? Why is an entire generation walking into therapists' offices already convinced of conditions they may not have? The answer is more complicated and more human than most critics admit, and I think you deserve to hear it without the usual finger-pointing. For many people, especially women, especially adults, especially anyone who has been overlooked by the medical system for years, social media has done something the medical system failed to do. It has given them a name for what they are feeling. It has connected them to a community. It has told them they are not lazy, not crazy, not alone, and in some cases those self-realizations turn out to be entirely correct. There are countless adults walking around today with formal diagnoses they only sought out because a 30-second video gave them the language they had never been offered. To dismiss all of that as harmful would be both untrue and cruel. But here is the line. And this is the signal I promised you at the beginning. The signal is not how much the content resonated with you. Resonance is not evidence. The signal is what you do next. If a video gave you language that made you curious, and that curiosity led you to seek out a qualified professional, to read the actual diagnostic criteria, to consider differential diagnoses, to ask whether your symptoms might be better explained by something else, anxiety, trauma, sleep deprivation, hormonal shifts, or simply the conditions of modern life, then social media did exactly what it should do. It opened a door. You walked through it carefully. But if a video gave you a label, and that label closed the door behind you, if you stopped questioning, stopped considering alternatives, stopped being open to the possibility that you might be wrong, that is no longer curiosity, that is identity. And once a diagnosis becomes part of your identity before it has been properly evaluated, three things tend to happen. And all of them are dangerous. The first is misdiagnosis. ADHD shares overlapping symptoms with anxiety disorders, depression, complex trauma, autism, sleep disorders, thyroid dysfunction, and even simple chronic stress. A trained clinician spends hours, sometimes across multiple sessions, ruling out these alternatives before landing on a diagnosis. An algorithm spends 30 seconds. The risk is that you treat the wrong thing for years while the real thing quietly worsens underneath. The second is inappropriate treatment. When self-diagnosed individuals push for stimulant medication, antidepressants, or therapies that are not actually indicated for their underlying condition, the consequences are not theoretical, they are physiological. Stimulants prescribed for someone whose real issue is anxiety can amplify that anxiety into something far worse. Antidepressants given to someone with undiagnosed bipolar disorder can trigger mania. The body does not care what you believe about yourself, it only responds to what you put into it. The third is the most insidious. It is what we might call diagnostic foreclosure, borrowing a term from identity psychology to describe the moment you stop looking for the truth because you have found a label that fits. Once you have decided who you are, you stop looking, you stop wondering, you stop asking the harder, more honest questions about your life, your relationships, your environment, your habits, your unprocessed grief, your unmet needs. The diagnosis becomes a place to rest, and the deeper work goes undone. You feel seen, but you do not get well. So what do you do with all of this? You do not throw your phone in the ocean. You do not stop watching the content. You do not gaslight yourself into believing nothing is wrong when something genuinely is. What you do is hold two things at once. You hold the gift of recognition that social media gave you, the language, the validation, the community, and alongside it, you hold the discipline of verification. You take what resonated and you bring it to someone qualified. You ask hard questions about whether the label fits or whether something deeper is being missed. You let curiosity stay open longer than it wants to, because the goal was never to find a name for your suffering. The goal was, and always has been, to actually feel better. So here is what I want from you tonight. In the comments below, tell me honestly, have you ever self-diagnosed from a video? Did it help you find clarity? Or did it send you down a path you later regretted? And do you believe content creators who are not licensed professionals have an ethical responsibility for the millions of minds they are shaping? I am genuinely curious where you stand, because this conversation matters more than the algorithm wants it to. If this gave you a new way to think about something you have been wrestling with, subscribe to Grit Harbor so you do not miss what comes next. Share this with the friend who has been sending you those videos at 2 in the morning. Next week, we are going somewhere darker. We are going to talk about what is actually happening to your brain after hours of scrolling, the cultural phenomenon people are now calling brain rot, and the growing body of research on what short-form video is actually doing to your attention, your memory, and your mind. It is real, it is measurable, and it may already be happening to you. And remember, no one here has to weather the storm alone. Thank you for staying with us.